little bit of swelling. And that's the joy of it, though, is that it's in the fat tissue, which doesn't have as many blood vessels. Right. So very slowly it gets absorbed throughout the week. If it went into the muscle, then muscles have a lot of blood vessels, so it would absorb fast.
Right.
So that's why the needles are so short and skinny, and it's really nice because you hardly feel them.
Right. Okay.
Well, okay. So let's get started. You know what? I don't want to drop your drink or mess your drink, but I kind of wanted to get your.
I'll set it over.
Are you sure?
Yeah.
Okay. Take a sip before you go?
Yes.
Okay.
I am very nervous about this. I apologize.
You are nervous?
Oh, yeah.
Oh, it's going to be so easy. You're going to be surprised. You're going to go, why was I getting so freaked? But what's good is you're nervous enough to do all this preparation, so you're better prepared than the average person.
Joe, or
honey, I love you, but I got to say, please, sweetheart.
Daisy, come here. Daisy.
I'm sorry.
Come here.
Let her outside now.
Come here, Daisy. Come on.
Come on, buddy. Come on. It's so hard not to pet her. She's so cute.
I'm
adorable.
sorry.
No problem. I just don't want to get dirty, right?
Yes.
Yeah.
All right.
She didn't touch me much, but this is good. Hey, I really love that you have a log started. Did they do that for your IVs?
I ordered those.
I know, but when you did that from your IV, that was so smart. Most people don't do it for their IVs. They only start one at home because they're independent, doing their subq one. Whereas the IV one, the nurse is here and keeping track of stuff. But you're doing your own thing.
Education is key. And
yeah,
that's the key. You have to be your own step-by-step.
So on the ball. I just love it so much.
The more information I know, the more comfortable I feel. So
yes, that's excellent. What's good, too, is you can keep track, of how you were feeling and what the benefits were and look back and see, oh, yeah, Right. Okay, subq therapy, look at it, it's right here. That's good. My catheter gauge. Oh, okay. Good. The pharmacy told you this?
I found that out through when I was getting IV, and they told me that it was going to be 9 millimeters.
Okay, that's for the IV one.
Yeah.
Okay, so these are smaller.
Yes,
that's why I wonder. Okay.
9 millimeters.
Great. All right, now, this is the IV stuff, though. Now lay down. Reaction, hip and bone pain. Is that what that is?
Yeah, they had to give me the injections of the
Benadryl?
Yeah, and then after that I had to start
slower.
Slower. They doubled it. They went from 2.5 hours to 5 hours.
There it is.
And then I pre-medicate every time with Benadryl Motrin.
And Motrin.
Yeah.
Good.
And I do have Emla cream.
Oh, good. Now that's for your IV.
For this.
Yes. Oh, okay. Did you already?
Yep. I don't know where we're gonna do it, but I put it on the belly.
Oh, good. So. Did you have something to put over it, like Saran wrap or something? Or?
No, he didn't tell me. So I just kind of put like a thick layer, and it
absorbed in, and it didn't get all over your clothes.
No.
Okay, cool. Well, one thing about this is that it rarely hurts much at all.
Okay.
So I think you might find that I don't even know if the Emla cream is necessary, but see how you feel.
Okay.
The other thing is usually the Emla cream. I don't know if you read the thing. Knowing you probably did. It's supposed to stay on for 45 minutes or something like that before, 30 to an hour, and usually it has to stay on in a thicker, like a thicker amount. Yeah, kind of like looking like it's lotion or mayonnaise on there. And the thing is, for that to stay on without a mess or without it coming off or dripping down or something, you have to put something over it, like a saran wrap, Glad press and seal. It might work because it kind of sticks,
Okay.
But I must say again, these needles are so small, you're going to find that it's such a no-brainer that you might not use it. Now, the Emla cream we use mostly is for somebody who has a port who has to have a needle that's bigger than that sticking through their chest into the port. That comes in handy. Or a child that's having an IV started. But you have to make sure you know which vein you're going to use to put the Emla cream in that spot.
Right, and that's why I really wasn't sure.
I know, so you put it all over your tummy. That's so cute. So usually we're going to use one side of your stomach and then the other side next week. And then they have some information about the different sites in there, right?
Yes.
And so you usually mark, too, where you're going.
Yeah.
And I was going to say, do they have something that shows the different sites that are marked?
For this?
Yeah, on this log?
I can do these, your back of your thighs, your arms, and your lower back.
Yeah, you're right here, this big wad of...
Okay.
Yeah.
A big flap.
Right, not so much the back, but it's that hip.
The fat.
The rump. Yeah. And usually they allow the inside of the thighs because that's fatty too usually unless you're real thin. But they said the back of the thighs, back here. Is that what they said?
Yeah, it said the back of the thighs. But my doctor also did say the inner thighs too.
Right. So between you got 1, 2, 3, 4 possibly. Maybe the 5, 6 is back here. They said, and 7, 8.
Yep,
and then 9, 10. So that's, I mean, if you really used all those spots, you could not go back to the same site for 10 weeks. You know what I'm saying?
Okay.
Which is pretty amazing. A lot of people, I must say, only rotate between 4 sites maybe. They like to go 1, 2, 3, 4 because it's so easy. And they don't have to try to go here. But see, you got a good helping
I'm
guy.
not doing it.
Yeah, he's going to do it. So that's good. And it's hard to reach back here too.
Yeah.
But there's a lot of good tissue there.
Right here. That
it would be a really good spot. So so I could see you doing at least 6 to 8 sites without any problem. You know what I mean? Maybe even more. Maybe even the whole 10. You know, which in a way is nice because it gives your tissues a lot of time to recover.
Yeah.
Exactly. And yet, somebody else was saying that if you give the medicine the same place more often, the tissues get even more used to it and don't have any of the reactions. Well, they hardly have that much reaction anyway. Right. But almost the first time, you almost always have some redness. Sometimes it'll itch a little bit, which Benadryl will help. Okay. Did you you didn't take any though yet, did you?
Yes.
Oh, you did take the both.
Yeah.
Good. And the Motrin. Yeah. So I'll make a note of that. But those tend to offset that, those symptoms as well. But I must say, even at different sites, you'll find week after week, whatever little side effects you get, they tend to lessen all the time. Okay. So it's really nice that way.
Well, the last IVIG, like all the IVIGs I would sleep for 2 days. This last one, I seemed to be better. I didn't
wipe you out as much.
I had a lot more energy. I was a lot more focused.
And you were just recovering from the throat sores too, right?
No.
Last IVIG?
No, the last IVIG it was on Friday. I felt great. I felt the best I've been feeling. Then Saturday and Sunday I started where I couldn't breathe as much.
Okay.
And Sunday it just completely, my air supply cut off.
Freaked out were you?
Yeah, pretty freaked.
Did you go to the emergency room?
No. I just took my inhaler and just did
the nebulizer too.
I have a nebulizer, so I use that, and then I ended up falling asleep. But then I had the oral thrush.
Yes, right.
So.
Okay. All right, well, the first thing, since we're nice and clean, we're going to take the caps off of these. It's real easy to kind of flip them off. And you're not going to figure that this is sterile under here. It's just going to be, these are considered dust covers. So go ahead and do that, because I want you to be hands-on so you're comfortable. And actually, usually what I tell people, it's nice to have like a grocery bag or a little trash can, just so we don't make such a mess of all the stuff.
All right.
So is there anything I can get? Maybe that's handy? Even the bathroom one? Or, that'd be cool. So, hey, she's not guarding me anymore. I can go over and get petted.
Hey, Daisy.
Or maybe another biscuit is what she's thinking. Perfect. Oh, that's awesome. Okay, thanks.
Go to Grandma.
Daisy, come here.
Give her a treat.
Go on.
Where's she at?
Go on, sweetheart.
Come here, Daisy.
Want a treat? Tell her you want a treat. They're in this drawer right here. Okay. They're in this drawer in here.
Oh yeah, in that nice
Stay right here.
The bottom
one.
one. Yeah.
Okay, great.
Right there. Left corner.
Now, maybe the next step we'll do, you can do these in a number of different sequences, but are you taking notes?
Yeah, we're videotaping.
Oh, you're kidding. Well, I better really be on the phone.
I won't
Just
post
get this part. Don't do my face or anything.
No.
And I want to sign one of those releases. All right. Okay. So then the next thing might be to open this up. So go ahead. There's one side that's easier to open than the other, and you just peel it back. And when you peel it back, I like to leave it in this little sterile boat because it's kind of a nice little holder. Okay, so go ahead and peel that back, honey. Put these over here. This off-site here. Yeah, that's good. And then flip it over so that it's kind of in its little container like that. You know what I mean?
Oh, okay.
Yeah, so this is clean too, but this is sterile. So, hey, why not? You know what I mean?
No.
Exactly.
Okay, so then we're going to go ahead and draw up some of the stuff and put it into here, and this whole bottle's going to go into here, right? Because we're not,
50 milligrams.
Right, and then what we're going to do is we'll get you set up and starting infusing this one, and while that is infusing, we'll get this one ready, so that when this is done, we'll just exchange the syringes. It's going to be very slick.
Okay,
you know what
so
I mean?
I'm only going to have 2 injections or 4?
You're only going to have, you're going to use 2 syringes, but that doesn't have anything to do with the with the needles. The 4 little needles will be already in there, and they only go in once, and they come out once, so it'll be very easy that way. Okay, so one good thing about this, let me just show you, sweetie, is if you rip these babies in the middle, the stuff pops right out at you, and you don't have to go searching in there. Okay, so just kind of rip it in the middle, and then just, wipe it off real nicely in the top. That's perfect, Excellent. And I'll put our trash right here so you can end up getting that. There we go. Great. And then you open one of these. Now, this is capped also at both ends. You see a blue cap, and then this spike has a cap. So you don't have to worry about that either. If you try to open this end, you won't be very successful. There's only one area that's easy to flip open. Okay. Beautiful. Okay. So now you can take that out of there. And our goal now is to get the medicine into the syringe to prepare it so that we can connect the tubing into you, and then give you, start it through the pump. Okay. So now this is good to stay covered, and then you uncap this one, and you're going to spike the.
Oh no, I don't do that. Do I?
Yeah. Well, you can leave it out. Chances are we're going to throw the bottle away with the spike in it. But if you did want to unspike it, I'd like to cover it. Otherwise, it's kind of a sharp. You know what I mean? It could hurt somebody. So you want to hold your hand here, and then, and just go straight in. And I could demonstrate for you, but it's so simple. There you go. Straight in, girl. Yep. And see how it holds right all the way to the end, which is perfect.
Okay.
Then you take this thing next, and then if you'll notice, this has got a little air in it. No problem, except it tends to stick. So pull back on this plunger to loosen that baby up a little bit. It tends to stick a little, and then if you pull back, it'll unstick. Feel it? Now you're good. Now pull, and push it all the way up. What's great is you don't have to worry about putting any air in here because this thing has a little air vent, and so it's going to allow the bubbles to replace the fluid so there doesn't become a vacuum in there. You know how that would happen normally?
Right.
Okay, so now the next thing is for you to, don't let this thing.
Sorry.
Yeah, that's okay. This we want to keep clean. That's why I was having you put it there. And I think it touched your blanket just a little.
Yeah, it did.
Which is no problem. But this is, again, do it in the middle. Grab one of those babies. And then just wipe the top of that for good measure, okay? Perfect. Now, if you want, you can place this back in here. And that'll stay clean. And we want to take the blue cap off of there. And so just secure that. It should twist. Now, that's perfectly sterile, too. So if it gets touched inadvertently by your thumb, you just have to wipe it real good.
Okay.
So grab this, and then you're going to just attach that in that same twisting. You push it in and twist it on. It's no needles or anything. It's just what they call a lure. Better hold this, though, so it doesn't rotate on you. Just twist it right on. You feel how the grooves go in? That's perfect. Yeah. That's perfect. Now, see, what you were going to do is, that's on tight. Nice. You were going to go like this and this start turning, but I'm afraid this whole thing, would turn.
Right.
So that's why I said hold that and let this twist on. And you see the threads are right there, right?
Right.
Okay, so now this is so easy. All you do is flip this upside down, and I'll show you just because you can do the other three. Flip it upside down and start pulling back, and you'll see the bubbles are coming in because the air is coming through this vent. And look, the medicine's coming right in without any needles or any problem. And it's really easy to pull back, whereas if it's real thick, through a needle, it's harder.
Right.
So go ahead and do that.
Okay. Do you do it fast or slow?
It really doesn't matter.
No. Okay.
Yeah. If you're strong, I guess you can go faster. It's not going to harm the little molecules or anything, but, usually that steadiness is perfect, They used to have it so hard to pull back that you really needed some strength. This poor man was pulling so hard that he pulled the plunger all the way out, and all the stuff went all over the place. And I told you how sticky and thick it is, right? So look how you're really there. Now, with this particular plunger, I see that this is a little bit high, and there's just a little bit left in there. So probably I would just go like that and then pull the last bit out. But I don't know if you really have to, because watch. Wait a minute. We're getting too close to the bottom. Let's push this air back in, honey, to give yourself some more room, okay? Push that air back in. There you go, because you don't want it too close to the bottom. And then pull back. Oh, it looks like it automatically pulled back in. Once you put the air in, it pushed it in for you. You know what I mean? Because when you push the air in, it creates pressure in there, and then it wants to get the fluid out. So look, you got it all out. Isn't that great?
So
it's perfect.
Okay.
Yeah, so now the thing we want to do is disconnect this by screwing that off. And you want to use this because if you take this off, you're still going to have this on. We really don't want that on anymore.
This whole thing.
Yeah, that whole thing.